Hi, and welcome to the show where we share the stories of the many who intersect with our healthcare system but are rarely heard from. My name is Kevin Poe, founder and editor of Kevin MD. Today on the show, we have Fady Youssef. He is a pulmonary and critical care physician, and he wrote the Kevin MD article, "A Frontline Physician Has a Message for You." Fady, welcome to the show.
Thanks so much for having me, Kevin.
So we'll get into your article in a little bit, but first off, can you share your story and your journey to where you are today?
Yeah, absolutely. So I grew up in Egypt. My father is a pediatrician, so medicine was always a big part of me growing up. And I actually got critically ill when I was in high school, and so that kind of sealed my fate into pursuing a career in medicine. I started medical school in Egypt, and my parents decided to make the difficult decision of uprooting myself and my sister and moving to the United States. And I re-pursued my passion for medicine, undergrad, medical school, and I recently finished my pulmonary critical care fellowship 3 years ago. And I currently practice in Southern California in a large teaching community hospital.
So we're speaking in the middle of September currently. How has the pandemic affected you and your practice?
In multiple ways. I was just kind of looking back at the article when I submitted it. It was back in July, and it feels like it was ages and ages ago. I think time has been going by. It's very, very fast. Currently, the numbers are going down, so things are somewhat normalizing and, giving us a little bit of time to get ready for the flu season and likely resurgence of COVID.
So let's talk about your article. A Frontline Physician Has a Message for You. So for those who haven't read your article, can you walk my audience through it and share the story of why you decided to write it?
Yeah, absolutely. So I think it was kind of a cathartic experience for me, going through the pandemic and seeing how things are being portrayed in the media. It felt like there were two different experiences that are being had. One that physicians and nurses and respiratory therapists and all the healthcare workers are experiencing, and one that's being portrayed in the media. And so my thought was I wanted to kind of express my views to those who likely disagree with me. I normally kind of keep my opinions to myself. I don't like to engage in unnecessary political debate or such, but my goal was just to share kind of how the pandemic is being felt from the belly of the beast. My experience centered around being in the intensive care unit as the pandemic was unfolding. And so there were two big points that I kind of wanted to express. One is one of the difficulties and the differences in this pandemic is in critical care, we're used to seeing patients usually as they're very, very sick, and the interactions are short and intense. With COVID, what we're experiencing is we have patients in the ICU sometimes for weeks, and you get to know them and know their families and know their stories. And it makes the loss that much harder because you've invested a lot of time. And so I have a lot of respect for our oncologists because they do this on a daily basis. In critical care, we're usually shielded from it just by the nature of critical illness. But COVID was a little different. And so, one of the things I thought about is the families of patients that we lost and how they would feel when they would turn on the TV and listen to somebody talking about the pandemic as a hoax or just another cold. And I think that adds insult to injury. There is a significant amount of human suffering that this pandemic has exacted on its victims. And its victims are not just the patients in the hospitals, but those around them. One of the difficulties that, we encounter is when you have somebody in the hospital for 3, 4, 5 weeks, and we have limited visitation policies, these patients are isolated from their families and friends and loved ones. And, in some cases, they unfortunately succumb to their disease and they never get to see their loved ones again. And so that's very difficult. I think the other point that kind of inspired me, and I may be in the minority on this, around the time of the pandemic kind of picking up, signs around hospitals all around me started calling healthcare workers heroes. And I think it's a nice sentiment, but my take on it is I think of a hero as somebody that walks into a burning building and walks out unscathed. And I don't think in medicine we're that. I think we are scathed by what we do, emotionally, physically. And my feeling and sentiment is, if you think we're heroes, I think physicians and nurses and respiratory therapists, and were heroes before the pandemic, and will be after, because we encounter many, many of those difficulties on a daily basis, but now it's just under the microscope because of the pandemic. And the other thing that I thought was, energy would be much better if it was applied towards ensuring that healthcare workers have appropriate PPE and making sure they feel safe, comfortable, so they can provide for their families and go home and keep their families safe. And if you think healthcare workers are hero, then strictly adhere to public guidance, even if it doesn't fit with what you think should be done.
Sure, that's well said. So, have you ever actually engaged with someone who thought that the pandemic was a hoax, whether in real life or on social media? And if you did, what was your reaction and how did you engage them?
Yeah, I stay away from social media because I'm more of an observer rather than a participant in social media. But I have friends and close family that did not share my views about the pandemic. And I try to share my experience and what we see in the hospital. And one of the reasons I ended up writing this piece is for a lot of people, they did not grasp the magnitude of suffering that hundreds of thousands of people have had to deal with because of the pandemic. And I found when we interact on a human level rather than debating and arguing about some people are talking about case fatality rates that did not know what case fatality rates were a couple of weeks ago. And so debating and arguing about those minutiae kind of did not lead somewhere, but talking about the human suffering that's happening right then and there seemed to go further.
So, why don't you paint a picture for us? Because there may be some people listening to this podcast who may not be taking the pandemic as seriously as they should. Can you paint a picture for us and tell me why they should be worried?
Absolutely. It's by virtue of what I do. I'm a critical care physician, a pulmonologist. So I usually see cases that are severe. And one of the things that I think is puzzling to a lot of us is knowing who's going to get severe COVID. And we don't know. And so I'll give you an example of an average patient and how they progress. So, middle-aged individual, fairly healthy, but maybe a little bit obese, maybe a little bit of diabetes, comes to the hospital short of breath. He's in the hospital for a couple of days, then he goes home. And then a couple of days later, his symptoms come back and they worsen. So he gets readmitted. But this time his symptoms are worse than they were before, and he comes to the ICU. And then what we're seeing with COVID is patients have significant degree of hypoxia where their oxygen levels are very low, but they look okay. And so we're able to give him enough oxygen to keep him alive and interactive. And at some point, something happens where we're no longer able to accommodate them. And so they go from this stage where they're just on oxygen, watching TV, eating, talking to their family, to a time where they go on life support and medically induced coma and multiple interventions that we have to do. Unfortunately, our success in getting those patients out of that state is not as high as we would like it to be. It's still, I think, with appropriate medical therapy, we're able to have a lot of patients recover, but we do lose a good number of patients. And the other component of what we don't know is when those patients recover, what kind of morbidity, what kind of state and health state they're going to be in 2, 3, 4, 5 years from now. We still don't know that. And so, if you look at the example that I painted, somebody who's fairly healthy, fairly an active member of society, working, taking care of family, then suddenly gets COVID from a social event or a gathering that they did not think too much about. And then 4 or 5 weeks in a hospital alone by themselves. Interaction is mainly with nurses and physicians that are behind masks and goggles and pampers and gowns and wearing gloves. Family is on FaceTime, and then they go into the critical illness where they're no longer interacting with the loved ones. And so one of the things that I think I put in the chart and my write-up was I've had this interaction with several family members when we call them and let them know, unfortunately, loved one passed away. There's nothing else that we could do. Is they shared, the last time I saw them was X number of weeks ago because I tried to quarantine to protect them and protect myself, and I didn't get a chance to say goodbye. And I don't know how many of us that are just learning about the pandemic from watching the news are getting the degree of how severe this is and how catastrophic it is to those families that go through it.
Now, what are some of the long-term morbidity effects that you're seeing from COVID?
It's not well delineated so far, but I can tell you what we're seeing right now already is patients that survive have some degree of lung damage. So a lot of patients end up, healthy people did not need any oxygen, not taking any inhalers. They survived COVID and now they're requiring oxygen. And some of my patients call and ask, how long am I going to be on oxygen? Or friends ask, how long is my loved one going to be on oxygen? And we're not sure. Imaging usually lags behind the clinical state, and the imaging is showing some degree of destruction of the lung tissue. And so they have that degree of hypoxia or lack of oxygen, coughing, and then a lot of fatigue and tiredness. And it takes, for young, healthy individuals that I know, friends and patients that survived it, it takes them weeks to kind of get back to their baseline. And so if you think of somebody who's a little older that may have some comorbidities, it takes even longer.
We're talking to Fady Youssef. He's a pulmonary and critical care physician, and he wrote the Kevin MD article, "A Frontline Physician Has a Message for You." Fady, I know that with critically ill patients with COVID, we have remdesivir, we have dexamethasone. But what about the patients who have mild symptoms? Do we have any treatments for outpatient cases of COVID?
Not currently standard of care therapies. There are some agents that are in clinical trials to assess those that are not too sick to come into the hospital and get the treatment on an outpatient basis, but nothing that's recommended as of now, just still the clinical trial phase.
Sure. And from a pulmonary standpoint, do you have any advice that you could give to your primary care clinician colleagues who may be listening to this podcast?
I think one of the biggest things that I know we're all caring about is just making sure we and our teams are safe, and just making sure, if you're in a clinic, that the staff is appropriately protected, patients are appropriately protected, because it's one of the difficult things is if somebody's coming in with COVID-like symptoms, how do you ensure that other patients that may be in the clinic, other staff members that are taking care of them are safe? And, sitting and devising a plan to make sure all of us are safe, I think goes a long way.
Sure. And my final question, do you have a take-home message that you want to share with the Kevin MD audience?
I just hope that as a society, we come together and everybody adheres to the strict guidance by our public health advisors, and hopefully we get past this.
Well, thank you so much for sharing your time and insight. And thanks again for being on the show.
Thanks so much, Kevin. I appreciate it.